I'm Hugh McCackey and I'm the National Director of Improvement. I think patient safety and the quality improvement agenda sit really tightly together, because if you even look at the patient safety agenda, we've got the insight, the involvement and the improvement as the three central pieces. The improvement piece is actually the vehicle for how we move from where we are to where we want to be. And I see my role as embedding an improvement culture and approach right across the NHS in England. And that will empower people to be able to make their services safer and better. So there is the safety piece and the improvement piece, and I think they go hand in hand together. I believe that using quality improvement tools and an improvement approach is the vehicle to enable us to get to a better place and a safer place for our patients. I actually think that this is almost the time for improvement as an approach and a methodology. You go back to last September in CQC releasing their report, which said that the outstanding organisations are those which have improvement embedded into the front line, into their culture, into the approach, into how they do things. So I think there's a timing issue. We have a patient safety strategy, the launch of this strategy, which talks about improvement being the vehicle for making our services safer and better. I think when you look around the country, we have more organisations which are committing to a quality improvement approach. It's one of the things that really motivates and energises staff. Lots of our staff are under significant pressure. We know that demand is growing, we have an ageing population, and a lot of our staff are coming to work and feeling that pressure on a daily basis. One of the things that energises and motivates them is to give them the authority and the tools to improve their service, to make it safer, to make it better. And when they do that, they know they're not just benefiting the patient in front of them, but they're benefiting all the patients that receive that service or that pathway. So it's one of the things and that's the great beauty of embedding improvement. It actually empowers our staff to make services better at the front line. Is improvement an in fashion at the minute? I had an old boss and mentor, a guy called William McKee, who sadly passed away in December. He had a lovely expression which was plucking feathers from passing geese. And I think one of the things we have to make sure with the improvement, and indeed with what we're doing in terms of safety, that isn't just a passing fashion, that people sort of pluck because it's the in thing at the minute. What we have to do is make sure that what we're doing with improvement embeds right down to the front line. It's embedded in our behaviours, it's embedded in what we do every day, instead of just being something that we talk about. The biggest challenges to safety and using quality improvement, I think, are that it needs to be cultural. It needs to be embedded right into our culture. It can't be, and I think we at a leadership level, whether that be nationally, regionally, or a system or an organisation, is that we have to make sure that this isn't just something we talk about, that we're going to do improvement, but we shift back to looking after the more urgent things. Quality improvement and improving safety takes time, and we have to make sure that we create the culture for that to embed so that it can happen over a sustained period of time. But one of the things that we'll notice, and I noticed this in my previous job when we went on this journey for 10 years, is the way staff feel about their work. They feel much more valued, they feel much more motivated and inspired, and they feel that they align much more with the culture of the organisation, that we as a system are putting quality of care at the top of the agenda. If you marry what we're trying to do in terms of patient safety with the improvement approach and culture, then everything we do should be underpinned by trying to make our services safer and better. And for me, that's one of the things when we talk about building the safety culture and embedding an improvement approach. What we're trying to do is give people at the front line the skills, the permission and the environment and culture to make their services safer and better.